we look at those numbers, we are doing our best to understand them in light of the information that we know about the community. So how people travel, where they patronize, how they connect in a meaningful way, person to person, because that is, of course, how this disease is spread. So we look at them geographically. And so we look at, early on, we had a cluster in the Federalsburg area. Through cooperation with Choptank Health Services, was able to identify that as connected to the poultry industry, which the governor's talked about, which has been a common problem across the United States. Meat packing plants, meat processing plants of all sorts have seen some of the highest rates of cases, and it's just the nature of the and how closely people work together. So we see a lot of that in our numbers, but we also just see, I think, what a lot of people kind of see across the country is the way people move around their community, and the fact that in Caroline County, people, because of I think the condensed populations in certain areas, and the popular shopping choices and popular areas of frequenting, it's not unsurprising that we would see it spread in the community as the way we have.
You see a pattern?
It seems a little bit more industry-based than density-based. We have, of course, seen a number of cases in Federalsburg, and that almost a significant portion of those were connected to the poultry industry. So it was either people who worked directly for the poultry industry or people who lived close to or were in close continuing contact with individuals who worked in poultry industry. We're starting to see cases rise up north in Marydale and Henderson area, and that is certainly not a densely populated area, but again is kind of associated with agricultural work in both Kent County and Queen Anne's County, where our residents work in those facilities, where they've seen higher numbers. It's a little bit challenging for Caroline County too, because we don't actually have these, for the most part, we don't have the industries within our borders. And so it means working with a company or several companies who are outside of our borders, but also with other local health departments, and in some cases with the state of Delaware, to make sure that we're all sending a coordinated message, that we are all working together to make sure that all the residents are well taken care of and have what they need. Officially, as far as we know, no deaths to date.
It seems like that speaks to the demographic that is getting the virus. By comparison, Kent County, I think, has 27 deaths recorded, and all of them are in assisted facilities.
And so we've had very few active cases associated with long-term care facilities, and mostly with staff that work elsewhere as well, which is what we've seen at other places. And thankfully, knock on this wooden table here, we have not yet seen a death in our long-term care nursing homes.
What's the road forward for you? What are you worried about now? And what are you going to be worried about in 2 months?
So the big thing that I'm worried about now is we still really don't understand fully this disease. We learn more and more every day from the doctors and the nurses, the epidemiologists who are working in this, better understanding how the disease progresses, how it affects our residents, because that's a long-term health and medical support need. And for a county that, again, doesn't have a hospital, and can at times struggle for health and medical resources, it's important to us that we understand this disease and how it will affect our residents long term. Moving forward, we talk about recovery to some extent, but the landscape is a bit unpredictable, given that we don't know if there will be a resurgence of the virus at some point. We don't know what measures, if there is a resurgence, will be taken at the state level. And so our job is to make sure that our residents and our businesses, our stakeholders, are as well informed as we are, that we are as transparent as we can be about the information we know, and really also about the information we don't know. I would continue to encourage individuals to seek information from reputable sources. We, like everybody else, have been challenged with some of the fake news or misrepresented information that has been going around that really drives contrary to guidelines being put out by CDC and by the Maryland Department of Health. So we continue to be as transparent and as open and as prompt with the information that we're sharing through our website, which is carolinecovid19.org. And we would encourage people to continue checking that website for the most up-to-date information on any measures that the state has taken, any public information or guidance that we have that we want the community to know about. It's the way we're going to beat this thing, is with correct information, correct guidance, taking the recommendation of our scientists to socially distance, to wear masks, to do the things that we need to do to stop the spread.